Hi, I'm Dr. Stephen J. Allen, Vice President and Chief Investigative Officer at the Capitol Research Center. Back in May, the Food and Drug Administration announced that it was assuming regulatory power over electronic cigarettes. The justification was that e-cigs are tobacco products, which the FDA has the legislative authority to regulate. The problem is, e-cigs don't actually contain tobacco. The FDA regulations ban sales to anyone under 18, but that was already being done in most states. And the regs impose all sorts of other restrictions on advertising, packaging, and so forth. Here's where big tobacco comes in. The regulations make virtually all e-cig products, even those currently on the market, subject to government approval. If they're not approved by bureaucrats, they're banned. The cost of approval for an e-cig product may be as high as $2 to $10 million per item. That's an impossible burden for an industry dominated by small manufacturers and shops. Of course, this approval process will be less damaging for big tobacco. Companies like Altria, formerly Philip Morris, Reynolds American, Imperial Brands. These megacorporations have their own versions of e-cigs, and they have the financial resources to cover the costs that small businesses can't afford. By the way, one of the people fighting to keep these regs is a member of Congress, Debbie Wasserman Schultz, who recently resigned as Democratic Party chairman after she and her staff were caught colluding with the Hillary Clinton campaign to defeat Bernie Sanders. And while e-cigs are not perfectly safe, they're much less of a health threat than old-fashioned combustible cigarettes. Except for nicotine, users of e-cigs are exposed to none of the roughly 7,000 chemicals associated with real cigarettes. E-cigs contain none of the chemicals associated with emphysema, none of the 60 chemicals in cigarettes that are classified as cancer-causing agents. Public Health England, a government agency in the United Kingdom, concluded that e-cigs are 95% safer than cigarettes. The Royal Academy of Physicians reached the same conclusion. As e-cigs became more popular among teens in the US, their use of real cigarettes fell 42% in 4 years. What happens when you restrict e-cigs? Smoking rates among 12 to 17-year-olds increased in states that banned e-cig sales to minors, up almost 12%. The Centers for Disease Control and Prevention under the U.S. Department of Health and Human Services refuted this by claiming that overall tobacco use by middle and high school students hasn't declined since 2011. You know how they reached that conclusion? They classified e-cigs, which contain no tobacco, as tobacco products. Bureaucrats lying? Who'd have thunk it? It's time our government starts thinking rationally about e-cigs and gets out of the way of proven harm reduction strategies rather than continuing to protect big business and big tobacco. To learn more, please click the link on your right to the full story on our website. If you like this video, please subscribe to us on YouTube, like us on Facebook, and follow us on Twitter. I'm Dr. Stephen J. Allen. Thanks for watching.